Good afternoon, everybody. It's Hazel Cheeseman here from ASH. Welcome to this webinar. I hope you are somewhere dark and cool, if at all possible. We're delighted to have so many people join us to close our Today's the Day campaign. I'm going to talk very briefly just about the campaign and how it's gone. I know that we've got people here from different places, some of whom will know a great deal about the campaign because you've been quite heavily involved, and then some of those of you from sort of pharmacy and NHS for whom this might be relatively new. And then I won't talk for very long. I'm just going to try and get my slides up. There we go. And then we'll hear from our colleagues in Slough, who will be talking about their experience of the campaign and the experience of delivering stop smoking services during COVID. And then Maggie and Louise, who I will introduce again later, who've been running our Quick Clinic online and have generally been doing wonderful things over the last few months since lockdown. We're going to have some of their reflections about supporting smokers. But we want to spend most of the time answering your questions, and we've already had quite a few through, so thank you for those people who have already sent questions through. If you want to ask questions, and please do, hopefully we'll have time for lots, then type your question into the question bar on the side, and we will work through them at the end of the after we've heard from the other speakers. If we don't get to all of the questions, we will try to circulate a response to all the questions that are asked after the webinar. Right, just a few introductory slides from me to introduce the campaign. So the campaign is called Today is the Day, as you can see here on the screen, and it came from the campaign started as something called Quit for COVID. Back just after lockdown, we were approached by a GP in Bristol who had commenced this campaign locally in response to smokers who were worried about smoking during COVID, and he kind of handed over the idea to ASH, and with partners we amplified that. And this was a completely unfunded campaign at the beginning. It was about engaging stakeholders, getting people to put the message out there locally, using social media where we could. And what it demonstrated for us was that COVID-19 was certainly a teachable moment for smokers, that it could engage people in quitting activity. So using that as a kind of point of principle, we managed to secure some funding from the Department of Health to launch what became the Today is the Day campaign. And that campaign has been focused on areas with very high rates of smoking. It has been a 4-week campaign closing today, with a combination of radio, digital audio and digital display. The target for the campaign was very much these C2D smokers in communities with very high smoking rates, and as I mentioned, it was funded by the Department of Health, and in Yorkshire and Humber, the Public Health England amplified the funding so that it could go across the whole region. And we've been delivering this with support from Public Health England and from the Fresh Breathe 2025 and the Greater Manchester Health and Social Care Partnership. So the campaign ran, as I said, on radio, digital audio and digital display in these areas around the country. And it comprised of this radio advert delivered by a respiratory consultant, quite a kind of powerful audio. Digital display ads that were positioned, and people could click on them, as you can see, to access the smoke-free website. And then a communications toolkit that had a range of different assets and tools that could be used both in areas where the campaign was running, but also we were encouraging local authorities and others to also make use of the assets. How has it gone? Well, we're still working on a full evaluation, given that we only finished the campaign today, and we're really keen, if you have been using assets from the campaign, involved in the campaign, any local data or local evaluations that you have, we're really keen to see them, and so we can integrate them into our overall evaluation. In terms of how the adverts have performed, the radio and digital adverts, the digital audio appear to performed pretty well. We've exceeded the number of people that we wanted to reach with those number of impressions that we wanted, the people we wanted to reach with that audio, and it has a 99% listen through, which is apparently very good compared to the industry average of 90%. And the digital display adverts have performed differently in different places. So we've had a good click-through rate in some areas and a less good click-through rate in others. So we're going to be having a look at that and understanding why it's behaved differently in different places. And we've had great media pickup as well, you know, really good pickup in the national broadcast and print media, and also local areas have amplified those media stories by doing their own press releases. And the activity on social media has also been good. We had a thunderclap today to close the campaign, which again has seen some good engagement. So before we kind of hear about how it's worked locally and what the experience has been of engaging smokers, which I think are some of the lessons that we want to take away from this experience, you know, how has it engaged smokers and how can we take this forward? I would say that in terms of next steps, you know, the assets are still available. If people don't have access to them or don't know where the links are, we'll make sure we circulate them again after this webinar. You know, keep using the assets if they're working for you, the social media assets and the other tools. We're going to be, as I say, reviewing the lessons and feeding that back nationally and sharing the insights locally. That's you know, what we'll be doing next, and you know, we're really keen to hear what's worked well for people locally as part of that evaluation process. And in terms of what's happening next on the kind of quick campaign front, we understand that October is likely to be going ahead, though of course with all that's been going on, the planning has been somewhat delayed there. So that's all of my slides, and it leads us into our next speakers from Slough. So if I can ask Vicky to hand over the control to Slough. I do apologise. There we go. Now we've got it up, I can see your names. So Celine and Tarana.
That's right.
Apologies, I should have asked while we were going. I'm going to hand over to you and to talk about the experience of supporting smokers in Slough during the last few months.
Thank you so much.
Thanks. Thank you so much, Hazel. Just to quickly introduce myself, it's Celine Ahmedkad, Head of Integrated Lifestyle Services. Tarana.
Good afternoon, everyone. I'm Tarana Afzali, the Stop Smoking Manager for Health and Wellbeing Slough.
So going on to the first slide. Health and Wellbeing Service in Slough was launched 1st of April. I know you're going to be saying during the pandemic and when the lockdown was in full swing. Health and Wellbeing Service, or as we like to call it, the HWS, is a fully integrated service which is working with 0 to 60 plus groups and is working closely with the public health nursing service in Slough as well, which covers the ages of 0 to 19 and 25 and those with special needs. The services we are providing for Health and Wellbeing Slough are listed on the side of the slide, and smoking cessation is one of the key service areas. During the pandemic and pre-lockdown, Solutions for Health had already planned services to go online. To ensure that these services ran properly, we made sure that our staff were supported throughout this period as well, who were also experiencing this pandemic. So we made sure that they had the right equipment. We had weekly team meetings with them. We provided them with weekly support for safeguarding issues if they were raised. And some of the things that we have, you will probably go on to find out, is that domestic violence had increased during this period. In fact, there were 16 murders by partners. Our Director of Nursing and Safeguarding has been supporting these online support for all the staff. We also provided a desktop app which was called Wellbot, which reminded staff to monitor their own screen time, exercise, advice on food and water intake, and mindfulness. For our stop smoking services, Tarana will explain what changes we have put in place with little or no impact to our service users' journey with us. Tarana, over to you.
Thank you, Celine. In Slough, the Stop Smoking service is a 6 to 12 weeks of support available for everybody living, working, studying, or also registered with a GP. We provide all our clients with behavioral support with nicotine replacement therapy or Champix, depending on their needs. And all our team are highly skilled to provide every support required for even mental health condition smokers and also pregnant smokers. We provide quit line support, so the contact can be arranged at any convenient time for our service users, including weekends and also evenings. The program involves giving weekly consultation across 6 or 12 weeks. So that it will be an initial consultation followed up by a weekly consultation to check how they're doing, to see how they're progressing, and if they are challenging, if they're facing any challenges, how we can help them to overcome these challenges. As well as giving the behavioral support, nicotine replacement therapy, and Champix, we also give them, they're able to download the Quit with Bella app, which they could use 24/7. And they can join the community to share their experiences and challenges and go through the journey together. There has been several adaptations during the COVID-19 period. As per government guidelines, we closed all our face-to-face clinics, including GP surgeries and all our outreach clinics, including our mobile units. But we replaced these straight away with online support and telephone support. We made sure that this was all communicated to all our service users and also our partners, so we can continue receiving referrals. 2 readings were suspended as per national guidance, including maternity services, and all staff received safeguarding training. We made sure that staff are aware that there's a likelihood that there could be an increase in domestic violence incidents. So they need to be more vigilant. They need to pay attention to every small detail. And if there's anything they're worried about, they need to flag it up with our safeguarding lead. We also implemented an NRT ordering system. So after each consultation, the staff, the advisor would place the request for the order of the client. The team working from the main head office would dispatch the product to client's home address, and the client would receive a notification that their product is being dispatched and is on their way. With all our Champix users, we also made sure that they continue receiving their service and there's been no disruption. So the Champix letters were emailed to pharmacists. So they just had to go and visit the pharmacy and collect their supply of Champix. At all times, we made sure that the government and NCACT guidelines were followed strictly. The service marketing during COVID-19. We use different forms of promoting our services. The social media campaigns, Quit for COVID, and Today's the Day, published an article in the Slough Express newspaper. We also made sure that all our stakeholders receive digital brand assets. And across the area of Slough, we worked very closely with GP practices, and we requested them to send a generic text to all their smokers, informing them that we are still here and we are more than ever happy to help them. We also sent promotional materials to all our pharmacies in Slough. And we used the form of GP newsletter to have our information on how GPs can refer smokers, and also brief guidance on stop smoking in pregnancy. And we also promoted our Quit with Bella app and made it free available for everybody in Slough to use.
So we now know that some communities have been more impacted by COVID-19, and certainly factors which impact or outcomes can be a lot worse if they smoke or have a weight management issue. We have worked with the CCG, GPs, pharmacies, and set up a program of online 12-week exercise program targeting the Black and minority ethnic communities. We promoted these through our sort of contacts with religious and community organizations. So the mosques, gurdwaras, churches. We've also been working very closely with SCVS, which is Slough Community Volunteer Service, to promote that this was also available for our smokers. The sessions have been set not only to provide exercise, but nutritional advice too, which is provided by qualified instructors and dietitians. So therefore the program was put together actually by experts, so we could actually provide that in different languages if required. And we did actually produce animated videos in multiple languages to talk about keeping fit and healthy during the pandemic. I think it's also quite important when you are providing exercise and nutritional advice to make sure that it is provided culturally appropriate menus, because sometimes you may provide some food or suggest some food which that may be something that that particular community does not eat or has heard of. We also made sure that it was gender balanced, i.e. certain communities may not want to exercise with a male instructor, so we had female instructors. We made sure that we actually had a variety of different languages. As we know Slough quite well, we know what are the prominent languages that are spoken and which BME group that we should be actually targeting.
Just some of other feedbacks that we've received during the COVID-19. It's fantastic to get these feedbacks and hear their stories. And it hasn't been easy either for our staff and also for our smokers, because as well as going through the smoking journey of giving up, they also have to go through the COVID-19 being locked down at home. So in general, the most common feedback that we have received is that they look forward to our weekly consultation. They look forward to speaking to our team and getting that, that extra push, getting that encouragement is something that keeps them going. And we constantly receive great feedbacks, which keeps our team members, advisors going to know that they're doing a fantastic job. Some of the lessons that we've learned during the COVID-19 period, it hasn't been easy, like I mentioned, for both staff and the smokers. But in general, the kind of feel that we've got is that there's been a demand for longer consultation time. So in general, we spend a lot more time speaking to our smokers. Sometimes they do just talk about how they're feeling, how they're finding the lockdown extremely difficult, but it also gives us an opportunity to look at their overall health well-being. It gives us an opportunity to be able to see if, as well as smoking, are they doing okay in terms of their emotional well-being? Are they doing okay in terms of their other aspects of health? So it gives us an opportunity to use this consultation time to refer them into other services that we run in Slough, and also with our partners that we work closely with. We've also found out that there's a high success rate of our clients in COVID-19 period compared to pre-COVID-19. Majority of the clients that have signed up with us, they managed to quit. They do look forward to the behavioral aspect of the service, so the consultation, the diary that we make them to go to do for us, and then going through the diary. All these behavioral aspects of the service is highly liked by a majority of our clients. And we've also found out that majority of the smokers they feel highly anxious. They have this, extremely high level of anxiety. So again, we do speak to them and we can help as much as we can, because all our team are highly skilled. However, if there's anything that we are not confident that we think it should be flagged up, we will either refer them to our other organizations or other services. And also, if there's anything we're worried about, we will flag it up with our safeguarding team. And there's also been a high demand for evening and weekend consultations. This is majority for smokers with kids, with toddlers, and the best time that they can actually relax and speak to us over the phone is evenings. So certain evenings in the week, we are very busy. And some clients have also given us feedback that they really enjoy the flexibility of online and phone consultations. So instead of booking and going to the venue, they actually prefer, and they find it, it works really well with their schedule to just speak to us over the phone and go through their program.
So I think I've already spoken about the provision of online weight management sessions, and this is now generally, it's not only available for the BAME community, but also for all our smokers. Because one of the things that smokers do worry about is gaining some weight whilst quitting. So this is available as well for everyone.
Fantastic, thank you so much. And we will be here for the end of the webinar for any questions you have, and we'll be more than happy to answer any questions you have.
Great, thanks both of you.
Thank you.
So keep asking those questions in the question box, and we will come back. I think there's lots of food for thought there, and both engaging the BAME population as well as sort of thinking about why it is that smokers, at least in the service in Slough, appear to be having a better success rate. I think that's something that we can come back and discuss more about in the Q&A at the end. There was the app, the Quit with Bella app that was mentioned during the presentation. We will circulate some more information about that. A couple of people have asked about that in the chat, and we'll also be circulating information about another app which Louise is involved with and may mention later. I think it would be useful as well in our Q&A to sort of reflect a little bit on the role of some of these remote supports as well. So we'll come back to those issues for our Q&A. So the next person I have to introduce is Maggie Milne from the Yorkshire Smoke-Free Service Manager. And as I mentioned at the beginning, Maggie has been helping us out with running an online quit clinic during COVID, as well as the experience of delivering her own service. And it's sort of a 20-year anniversary for you as well this year, Maggie, isn't it?
Oh, sorry. Yes, it is. Yeah, 20 years in November.
Well, congratulations on still being with the service and still being quit smoking.
Thank you.
And, I'll hand over to you for your reflections before we bring in Louise.
Thanks very much, Hazel. Okay, good afternoon, everyone. My name's Maggie Milne. I'm the service manager for Yorkshire Smoke-Free Sheffield. I'm sorry, I've not had time to prepare slides, so I'm just going to talk you through how our service has coped and adaptations that we've had to make through COVID-19. I would just like to say that Yorkshire Smoke-Free Sheffield actually falls under the trust umbrella of South West Yorkshire Partnership NHS Foundation Trust. And in that trust, there are 5 stop smoking services. So we're commonly known as Yorkshire Smoke-Free. So we have a lot of expertise from Sheffield, Doncaster, Barnsley, Wakefield and Calderdale. So I'm speaking obviously about Sheffield, but a lot of this information is across the trust. Okay, so like other services, we quickly stopped carrying out face-to-face support following NCSCT guidance and guidance from the trust and obviously the government. And we started to commence telephone support. Now, Yorkshire Smoke-Free already has a telephone support service, the Yorkshire Smoke-Free Hub. And this service will answer all queries and telephone calls from the public back on one central number, and then they will make them appointments if they want telephone support or refer them back into our service should they want face-to-face support. So that was already established and very successful. Our clinics in Sheffield, most of our clinics that we run are in GP practices. We have 31 service-led clinics that we carry out within a GP practice. Following guidance, they also decided that they didn't want us in the building and that, we would obviously like us to continue to support their patients, but we needed to do this by telephone. So again, we had to pull out of the surgeries and continue to do telephone support for those clients as well. Luckily, all of my staff and all of the Yorkshire Smoke-Free team are fully agile. So we have laptops, SIM cards, telephones, lone worker devices. We've got all the equipment, so we're quite easily able to get home and get logged on without any interruption in business continuity. So that was really useful. We could crack on without, you know, any pause, as I've just said. With regards to carrying on clients that had already been supported face-to-face and now we're doing telephone, anecdotal feedback is actually now they prefer telephone support. We were quite concerned at first that, you know, they wouldn't want to continue with the programme, but it was actually not the case at all, and people were really happy to carry on being supported. And like they were saying, your other guests were just speaking, the confidence around quitting seemed to have been escalated by worrying about COVID-19 and the symptoms around. If you smoke, obviously, then that can be quite worse. So again, we picked up more referrals and were able to continue as we had been doing. We did see a slight decrease. This is Sheffield only, just to point out. We did see a slight decrease in April. However, in March, our referrals were up by 89 referrals on that time last year. So again, we put this down to maybe the initial lockdown period or the imminent of the lockdown was caused quite a bit of panic. But what I can tell you is those clients actually stayed in service, and over 70% of them did go on to stop smoking. So that's really good, because I was concerned, obviously, that they may be panic quitting and that it wouldn't go on to a successful quit. So that's really good news. With regards to medication, luckily, well, I don't know if it's luckily, it was quite a problematic period, but we actually switched from paper medication vouchers to online vouchers to electronic vouchers. So as soon as we saw a client or spoke to a client, we could generate a voucher code. This code went to the client's mobile phone, which they took to a pharmacy to get the items dispensed. This has obviously made it much easier, especially during this period where people aren't able to be seen face to face. As for collecting this from the pharmacy, some pharmacies were happy to deliver. The people that were shielding, then they had family members that were able to collect the items for them. And we did arrange with pharmacies in Sheffield to make exceptions for people that may struggle to get into the pharmacy. So as far as I know, no other services have had problems with that either. We also have PGDs in Sheffield as well, so Champix has not been an issue. We've been able to continue with Champix. And with regards to consultations from the pharmacy for the initiation of the drug, they've been carried out over the phone. So again, we were quickly able to intercept that, and the pharmacy team have helped us establish that service, which will probably continue. So I've talked about the hub. I've just scribbled notes down, I do apologise. So moving forward then, just to talk about a little bit about social media, we did obviously roll out the toolkit for Today's the Day, and we use that across all our social media sites. So that's Twitter, Facebook and Instagram. So we've continued to post that out, and on our website as well for our online quitters. One of the services now is looking at carrying out Skype consultations, and we're just piloting that at the moment, so I don't have any feedback. We're also looking at purchasing disposable CO monitors, and not just because we can't CO monitor at the moment, but moving forward about vulnerable clients that may not be able to get into service, that we may do a virtual consultation with. We can start to monitor carbon monoxide readings via the disposable monitors, but again, I'll update on that once I know more. The telephone support, as I've just mentioned, has gone really well, and we were really worried that this would impact on the telephone service it's already really successful in Yorkshire Smoke Free. But what we found is it's just enhanced that, and all services now are really, really busy. And I know I've talked about figures being a little bit down in April, but they are now starting to pick up again. So we think people are now starting to feel a little bit more confident about stopping smoking and contacting services. The message is still out there that we are open for business, and that goes out weekly on our media pages, etc. GPs are aware of that, and they're still feeding into the service, referring clients into their clinics. One really positive outcome has been that normally our clinics in GP practices would only see their own patients. Well, now, as with telephone support only, we can book anyone into any clinic. So that's added more flexibility. And as Slough we're saying, you know, we've also got some out of hours service as well, so we can accommodate people that aren't able to have telephone support during the day for child care problems, etc. So what we're looking at now as a service are recovery plans. So now all the Yorkshire smoke-free services are coming together to look at how we're going to get back into some sort of normality once this pandemic is sort of stable, if that's the correct word. So we've been carrying out risk assessments on all our venues, community venues. Our GP practices have done their own, but they've shared that information with us. Any community buildings that we work in. We also in Sheffield have a permanent shop in our local market that's open 6 days a week, 6 days a week and all day long, like 8 hours a day. This is still currently closed. And due to obviously restrictions around COVID and being able to work 1 metre, 2 metres apart, this is going to involve a bit more in-depth risk assessment. So I think there's still plans to open that, although the market slots are still very busy. They're just being supported by phone. So just to finish off really, anecdotal feedback from all our clients is that they really do prefer telephone support. They like the flexibility of it. They don't feel as intimidated. They feel that they can be more honest because they don't feel embarrassed because the person can't see them. We are assured that, you know, people are being truthful about quitting, because obviously no one can verify this at the moment. But that's something to work on in the future, about what we're going to do around that. But that is a national problem, as you're all aware of that. And basically that's it really. It's ongoing, the recovery plans. I mean, we would like to get back to a face-to-face service. We're a specialist service, and that brings its own, you know, advantages for lots of different reasons. So I will be around as well till the end of the webinar, so if anyone would like to ask me anything. I do apologise for the backwards and forwards, but I've just been scribbling notes, so please feel free to ask if there's anything you'd like more information on.
Thanks, Maggie. I think that's really interesting, and it's interesting to hear how experiences chime. You know, Sheffield and Slough, I'm sure, have their similarities, but also their differences.
Absolutely.
And that we kind of see kind of similar patterns. Really interesting. Anyway, we'll come back to all of this in our Q&A. We're just going to introduce Louise Ross now.
Thank you.
So thanks, Maggie. Louise, do you need an introduction? I don't know. So Louise was the manager for many years in Leicester and is now an expert with the NCSCT, and has also been running the Quick Clinic with Maggie. So I'll hand over to you, Louise, for your reflections, and then we'll move into the Q&A.
Lovely, thank you, Hazel. Am I coming across? Oh yes, I can see if I'm flagged as talking. Yes, thanks, lovely to be part of this. So I'm just going to do a bit of a reflection on what it's been like to do the Quit for COVID clinic and support. Now, we've been doing it for 20 weeks now, since the beginning of April, me and Maggie. And it's been quite a journey, a very special journey, and I've really appreciated working with Maggie, who's got, you know, fantastic experience, and what it turned out to be wasn't exactly what was envisaged at the beginning. So we assumed it would be like a Twitter-based clinic for people who wanted help to stop smoking. But as those of you will know who have tried to get a successful quitter to, or somebody who was just at the start of their journey, to go public so that they can encourage other people, it's very difficult to get people to put their head above the parapet and show others what they're doing. I think it's an intensely private business, stopping smoking, and we perhaps didn't have as many people, you know, wanting to ask us questions in public as we thought at first. What we did have was some very interesting private messages. So one particular service user stands out in my mind, and he said that, and he was very young. You could tell the way he expressed himself. He was pretty young. He was forcing himself to he was forcing himself to smoke, even though he didn't want to continue to smoke, because he thought it would give him protection from COVID. And you know, that was quite a difficult one to deal with, because he was absolutely convinced that smoking would give him some protection. And I think we'll come back to this at you know, at Q&A. I think you know, we'll all have something to say about that. But that was one particularly interesting private discussion that we had. What we did find, though, was that our content and our copy was seized upon by other organisations who wanted to put stuff out to their networks. So we had NHS trusts, charities, health and wellbeing groups, tobacco control people, training organisations, retweeting us, saying that they were going to use our copy for their own internal and external communications. And I just checked back on the private messages. I had one message saying, "We love your content, it's incredibly shareable." And how nice that was, that, you know, when Maggie and I were thinking, what should we tell people now, you know, that the other organisations were seizing this and using it to communicate to their local smokers. I'm really pleased about that. We were pleased to showcase what excellent work the Stop Smoking services were doing, including those who are increasing their use of vaping as a way of stopping smoking. We know how challenging it has been for Stop Smoking services to keep going during COVID, but you know, the imagination, the creativity has just been amazing. And you know, as we've heard from the previous speakers, would-be quitters have really appreciated this. Messages like, you know, do it once, do it well, not another puff. So many little lovely sound bites that seem to have been created through the Quit for COVID work, that can be shared and used to inspire people. I love that. Misperceptions about smoking came out very strongly. People who had, you know, maybe, you know, had the suggestion given to them by an advisor that they use nicotine replacement therapy or a vape, and they would say, "I don't want to be addicted to something else." And this seemed to be a very, very common response from people who don't understand how very effective clean nicotine can be in your attempt to stop smoking. So again and again, this sort of message came up, and Maggie and I were able to tackle it and reinforce that using enough nicotine as well is a really good thing when you're trying to stop smoking. We know that people don't use enough often. They'll cut their patches in half, or they'll skimp as much as they can possibly do with their lozenges. They must use enough, and we were able to kind of reinforce that, because nicotine isn't the problem, it's the smoke. And that, I suppose, led on to other key messages that seem to resonate with the audience, that you know, all smoke is bad. So whether it's roll your own, shisha, herbal cigarettes, you know, people seem to look for an alternative that's still smoking, but you know, isn't cigarettes. And of course, you know, the advisors, the Quit for COVID people, you know, other public health people need to kind of really reinforce that message that smoking of any sort is what causes the harm. Smoke-free homes came up regularly as well. That you know, so yes, I suppose we weren't just talking about COVID by the end of the campaign. We were talking about beyond COVID as well, and the things that will still be a problem long after COVID is tackled. If you know, we obviously hope it will be, but things like cancers, respiratory disease, cardiac disease, and exposure of secondhand smoke, you know, to the family as well. That was really good, I feel, to get those sort of messages reinforced in a way that was received by a wider section of the public health and smoking community than we might have reached otherwise. So that's really it. I mean, I know we're going to have questions in a minute. What I was really pleased to do as well was use some insights from the advisors on the smoke-free app that I help run. They are talking to smokers all the time on the app and getting some really nice insights, and we were able to kind of redeploy some of those, especially some of the misperceptions about smoking. So yes, I'm grateful to all of those people who gave us ideas to circulate, and let's have some questions. Thank you.
Thanks, Louise. That was really interesting, and I think our massive thanks from Ash and from all of the other partners involved in the Today's the Day and Quit for COVID work, to Maggie and Louise for giving up their free time to run the Quit Clinic, which I think produced lots of, as you were reflecting there, lots of really interesting insights. I just wanted to ask you one follow-up question, Louise. You're sort of reflecting that smokers weren't engaging particularly on Twitter. Do you think that Twitter is a good place to engage with smokers, to communicate out to them, or is it the sort of wrong forum altogether, or is it just that they, as you were saying, that they were not comfortable with the public to and fro?
Yes, I think there was certainly a privacy issue, that they maybe didn't want to expose their what they might see as their weakness or something like that, and have people make comments. I mean, I suppose anybody who uses Twitter knows that once you put something out there, people can make all sorts from it and troll you if if they don't like what you said. So maybe there was a bit of shyness there. We certainly had people who were very, very proud of themselves. So Phil particularly, is our famous quitter, I suppose, because he loved he loved telling us how well he'd done, and he was really the exception to the rule, I think. So he's very proud of what he did, and we're all proud of him. But generally speaking, I think there was a feeling of people would rather have the privacy.
Yeah. Okay. I wanted to bring the other speakers back in again, and I think it was really interesting to hear the insights of the messages that sort of were resonating with people from Louise. I just wanted to get perhaps one or two reflections from each of you about what specifically within this time during lockdown, in light of the pandemic, what you think the messages are that have been resonating with smokers most strongly. Maggie, perhaps if I come to you first.
Yeah, I think for me, it's the misperception around nicotine replacement is harmful. We've had a lot of people at the service saying, well, I don't really want to be putting more nicotine in. So there's been a lot of conversations around that, which surprised me really, because it made me think, well, are we not doing that anyway? Are we not explaining to our clients what nicotine replacement is?
Rather than those, Maggie, do you think those fears have been more pronounced during COVID than previously?
Yes, I think so. Yes, yeah. I mean, I don't do a lot of advising myself just now, but my advisors are saying that it has been up there along with vaping as well. So I feel that's the main thing that's come out of it for me, and running the clinic as well. Like Louise said, we've had a lot of thing about, well, what's the point putting more in? I'm trying to get rid of it, not. We've tried to dispel those myths as best that we can, but it just shows. And like I know Louise has been mentioning about, well, it's better if you carry on smoking, and we've also had a couple of people that have been worried about that, and a few private messages. I think, Louise, I'm right. I know we've had a few people, obviously private messaging, because they don't want to open up about it, on that platform.
Yes.
So in Slough, does that resonate? What do you think were the messages that were resonating for your smokers during this period? I don't know which of you wants to talk first.
I'll take that one, Hazel. Just to add on to what Maggie said, I run consultations. I do consultations myself, so giving you that first-hand experience, that majority of clients have this fear that if they have tried before, there's no way they'll be able to succeed now during COVID-19 period. But majority of clients, after you go to the first consultation, they agree and they've actually managed to quit. So it's giving them the right help, the right advice, and the right consultation, and how you go through the session, you can convince them and you can encourage them to give up smoking. That's the most negativity that we get to start off with, despite that they need to give up and they've been referred by their doctors. They are worried, they have fear of anxieties and everything. It's just adding together.
And we've had a few reflections on the fact that people appear to be more successful at quitting at the moment, and I think that's also what the national data is indicating as well. And there are a few people in the questions reflecting that they also see an increase in success rate. What do you put that down to? I'll come to you first, Louise. Why do you think it is that people are more likely to achieve a successful quit right now?
I think there's a few factors there, Hazel. I think there's a new determination to do whatever it takes to keep yourself well. So, you know, when people are making huge sacrifices in terms of, you know, not seeing their family, not going out, you know, working in more difficult circumstances at home for themselves, that sort of thing. Stopping smoking just is, you know, is another thing that they might as well do, they think, and get it done. The fact that they haven't been able to go to pubs, restaurants, you know, go out with their friends and smoke in a social setting is obviously something that will have an effect there. Although, you know, we know that, you know, in certain quarters there has been more smoking because of that, you know, staying at home. And you know, there was something on your newsletter today, wasn't there, about more house fires, possibly from people working from home. But I think generally it's about a new determination to do something to keep yourself well.
I was very struck. We've got quite a few case studies on the Today's the Day website, which, you know, people can go and have a look at. The determination certainly coming through from people in that strong sort of health motivator, but also what you alluding to there, Louise, about sort of changed circumstances, that, you know, if your lifestyle has changed a great deal, sort of disrupting that behaviour maybe is making it easier for people to quit. So one person was giving me the example of, you know, I used to smoke on my walk to work and now I'm not doing that, so I'm not, it's much easier not to smoke. So I think there's something interesting as lockdown eases about the risk of relapse. I mean, Maggie, I don't know, is that something that you're, you know, reflecting on as a service, you know, that you might end up with people who do relapse because they go back to old patterns of behaviour?
Yeah, I think so. I mean, at the Sheffield service, we're commissioned to deliver a 12-week quit. So we offer we offer consultations for 12 weeks every week. So we do, you know, we have got quite a good success rate at 12 weeks. But you are right. I am concerned that, you know, we have had a lot of people that have come into service, and you think, are they coming because they're panicking? But you know, what I can tell you, Hazel, is at the moment it's not looking like that's happening at the moment. I mean, we'd have to do some work at 26 weeks just to see how people are getting on, just to see if we've had that, you know, they've had that longevity of a quit. But yeah, I mean, services are always worried about relapse, and you know, historically we know that it takes a few attempts before someone will crack it. And I think going back to your colleague from Slough, you know, it's a lot of people are thinking, well, you know, what if I can't do it? I've tried before. But I think COVID's given them a reason. It's given them a focus. It's made people think about their life and their lifestyle. And, you know, they've been indoors, and they'll have had people that have been ill or you know, sadly died from COVID-19. So I think everyone's looking at their own mortality. And because services are engaging and saying, look, come back, it doesn't matter how many times you've tried to stop, you know, it's never too late, never stop, you know, never give up giving up, excuse the cheesy bit, but you know, that's basically what it is. And people think, well, they can't do it and they're lacking in confidence. But you know, all across Yorkshire, smoke-free, our numbers are really high and good at the moment, you know, so people are still engaging. What worries me more, Hazel, is when we go back to face-to-face. Or, you know, because it's not just I'll see an advisor who's wearing PPE, it's the whole environment, isn't it? So we'll have to see.
Yeah, we will. I'll come back to the kind of issue of face-to-face versus telephone. I do want to ask Slough, either Selina or Tarina, thinking about, we've talked about the fact that smokers appear to be more successful and, that perhaps approaches to services have gone up. And we'll obviously move to this more, remote way of supporting people. Are you seeing any differences in the types of people that you're supporting? Do you think there's anybody that is really being left out at the moment, for whom this way of working just really isn't right for them?
Thanks, Hazel. I think the most area of concern is the pregnancy group. It's because of the maternity services, the CO readings have been suspended. So we're not receiving as many referrals as we did before. So my only concern is that we might be missing out on a group there that might need our help, and that's an area of concern that we're currently working on to see how we can.
That's really interesting, because it does suggest that the change in practice around carbon monoxide screening is making quite a difference to referrals there. And obviously, all services have suspended carbon monoxide as part of the model. Do you think, and yet success rates seem to be quite, holding steady? Do you think are there parts of your practice which are suffering because of not being able to use carbon monoxide screening, and it would be welcome to be able to use that again, in addition, aside from the smoking and pregnancy issue?
You mean other areas other than pregnancy group?
And other ways of, that you would not, that you think it might be impacting on how you're supporting people?
I think certain, perhaps most deprived area where they may not be able to have access to social media, internet. In the past, we've used our mobile units to reach them and to do the face-to-face, consultations there. That might be an area that might be at the moment suffering, as well as the pregnancy group. But as soon as we are able to go back on the field, we might be able to reach them as well.
Maggie and Louise, I wonder if because there's a couple of questions as well about, whether there are particularly groups of disadvantaged populations whom we might not be reaching at the moment. What are your reflections on that? Come to Maggie first, maybe.
Yeah, well, we work quite a lot with the homeless, and we've not been able to engage so well with the homeless people due to lockdown, etc. We've tried to work with organisations that are still working with homeless people. We also used to see quite a lot of homeless people would pop into our unit in the local market, and obviously that's been closed and we're not there now. So I think that's going to have an impact. I think on the general population, even our most deprived smokers, I can't see that we've had any decline in those numbers from those priority groups. If anything, BAME communities, that's increased quite significantly, but the GPs have been doing a lot of work, and the CCG have helped us get messages out through the GP. So, but it does worry me. I mean, mental health, clients with a mental health problem, we know ideally are better supported face to face. So, we have seen some disruption with that cohort of smokers. But yeah, it is worrying.
I wonder if I could come to you with a. Go on.
Oh, so sorry. And sorry to interrupt. I was just going to mention about the pregnant smokers and how things are getting a little bit difficult. We're actually looking at in other areas, and we're finding that obviously CO monitoring is impacting quite a bit of because some people are now, some women in particular, sort of cheekily saying that they don't smoke or they have stopped smoking. And with that in mind, we have actually started working with Hilary Waring to see how we can engage that particular group, and in particular this period of time, which is quite important, that they should be quitting smoking, because it's not about just themselves, but it's also for the unborn child.
What I would say to people who are listening who want more information around smoking and pregnancy and COVID is that we have a smoking and pregnancy information network, and we are, as we get it, putting information out through that network. So we'll circulate the information about that following this webinar. If people aren't signed up to it and want to be, then you can do so. Louise, I just wanted to come to you. We've got a few questions about sort of talking to smokers about the risks from COVID, and you mentioned that you'd had a private message from a smoker who said they felt that, you know, that their understanding was that smoking might be protective of COVID. I wonder if you could talk a bit more about what the best way is to talk to smokers about the risks from COVID, you know, the relationship between COVID and smoking at the moment.
Yeah, sure. Well, I'll do my best. I mean, I think it's the updated evidence that's coming out from the researchers has been very interesting, and it's very important to kind of look at the detail closely. And I think, you know, the ASH update on this is really helpful. My take on it, and correct me if you think this is wrong, is that if, and it's not substantiated yet, if nicotine itself has got a protective effect, it simply underlines how important it is to use clean nicotine in the form of NRT or a vape to help you quit and stay quit. So, you know, if there is a protective effect there, you're getting that benefit, but you're primarily getting the benefit of getting a successful quit. That's what I would say. How does that sound?
Sounds good to me. Yeah, and I think that's how we've been talking to smokers. I also I don't know if others have a feeling about how, you know, we're moving into a new phase of this pandemic, which will, you know, in the winter, and while there are things that we don't know about smoking and COVID because it's novel, there are certainly things we know about smoking and flu and other things which circulate during winter and create pressures on the NHS. Do we think that's a message that will resonate with smokers, that, you know, if you quit smoking, then you're going to reduce your risk of flu, reduce the likelihood that you'll, you know, need to go into hospital or access NHS care during what will be an unpredictable winter? Is that a message that we should try to get out to smokers a bit more widely? I'll come to you first, Maggie.
I think so, yes, because I think if we don't mention it around the winter and flu season, I think it's gonna give the assumption that it's okay now sort of message, you know. So we already do a lot of work around the flu clinics and flu times and messages around the dangers of smoking and respiratory illnesses, and obviously COVID-19 is one of them. So I think we do need to keep, you know, giving out that message. Definitely.
Tarana, what do you think? Do you think that would work for your smokers in Slough?
I totally agree with that, yes. I think it's the time for us to make sure that they don't relapse, and also that it's still as serious for them to give up their habit and to manage quit smoking. And I think it's a perfect timing, perhaps around Stoptober promotion maybe, or something within those periods, to work on this and pass this message across. Yes, definitely.
And Louise, I'll leave you with the last word as we reach the end of the webinar.
Okay, thank you. Very quickly, I've been asked many times now from an NCSCT point of view, when are we going to say that you can open up clinics again? Well, we are in the hands of Public Health England in a sense. Their advice hasn't changed at this stage. So remote clinics are still the thing. I know some areas have formed local solutions. They've risk assessed it and made their own decisions. But generally speaking, you know, we are saying we are guided by Public Health England on this. Look at it as an opportunity. It gives you the chance to reach people who may never have come to a clinic, but can afford the, you know, 15-20 minutes for a phone call. They might not have travelled to go to an actual clinic.
Thanks, Louise. I think that's a great note to end on. I mean, I do think we will come back to all of these issues around face-to-face versus remote. There's clearly, you know, lessons to be drawn from how services have worked during this period that we want to hold on to in the future. And I think, you know, there's so much to be optimistic about in terms of, you know, the response from smokers, how services have performed during this period. And so, you know, well done to everybody out there who's doing such a great job. And we'll circulate lots of information after this webinar, things that we've talked about. And those of you that have asked questions that we haven't got to, my apologies, and we will provide a response afterwards. Thank you to all of our speakers for today. And
Thank you, Hazel.
have a good stay cool for the rest of the afternoon if you can.
Thank you. Take care.
Bye. Bye.
Bye.
Bye. Bye.